Hello and Assalamu alaikum. Ultrascan Diagnostics there. This is the CBCT of the patient that you had requested. The area of interest is the upper right and the lower right wisdom teeth for evaluation. This is the panoramic view. As you can very clearly see, the upper and the lower right wisdom teeth are have cavities. The lower right is grossly carious, where the upper right is not as severely cavitated. We'll start our assessment with the upper right one first. The upper right one is slightly over erupted. As you can very clearly see here, this here is the upper right one, and we've got quite a few roots in this tooth, but all of them seem to be fused together and don't have a divergent root form. If we look at it from an axial point of view, which is top to bottom view, here you can very clearly see, sorry, here you can very clearly see this guy right here. So fused roots, we've got three fused roots, three fused canals. So the extraction should ideally be very simple, slight bit of curvature distally, but no divergent root pattern. And as you can see, we've got good thick tubulosity bone present distally as well. Now we're going to move our focus to the lower right wisdom tooth. Now, the lower right wisdom tooth is grossly carious, as you can very clearly see right here. Very close to the inferior alveolar nerve as well, which is right here. So we're going to focus on the mesial aspects first. This is the mesial root. Approximately, we're looking at just a millimeter, less than a millimeter of the closeness between the apex of the mesial root of the wisdom tooth and the inferior alveolar nerve. As we move further back, this is the mesial root right there. This is the interradicular bone, and now you can very clearly see that this is the distal bone right here. So the distal root comes again very close to the inferior alveolar nerve. This is the root apex, this is the inferior alveolar nerve. So you can very clearly see that there is a point where the root apex is compressing the inferior alveolar nerve canal right there, and there we go. So this is the area where which is going to be the most trickiest for our doctor. This is the sagittal view, the side to side view. Here also you can see that the inferior alveolar nerve is very closely associated with the root apices of the mesial and the distal. The distal actually just compresses it at this point right here. Thank you very much.